My name is Valentina Bardeggia. I'm 33 years old. I live in Rome. I joined the FI Academy in 2019 while doing my first Fibrows course. Currently, I'm an assistant master Fibrows, a technician fee removal, and an artist fee couture, and a Philips student. I have a great passion for trigopigmentation, the technique that allows you to intervene on the scalp affected by baldness or scarring in both men and women. My technique is innovative, dynamic, and decisive. The big difference lies in the way the needle comes out of the handpiece. The disposable plastic cartridge Revo 1 point with a diameter of 0.4 mm comes out of the handpiece according to the skin tissue up to a maximum of 0.5 mm. The imprint of the tip of the handpiece on the skin is an excellent guide to avoid creating points too close to each other. In addition, by maintaining the handle perpendicular to the skin and the rebound mode constantly, it will be possible to work every single point at the same depth with the exact same pressure. This grants us unvaried results throughout the entire work, and the various areas treated have more or less the same pigmentation, avoiding the formation of huge dots. The combination of a circular point casts in the shape of a flower or hat, according to the cases, more or less concentrated, more or less thinned, on hairless areas, or on areas which already have some very little hair, goes to create an optical illusion which gives the natural effect of the hair in the regrowth phase, or a shaved effect in case of baldness, density effect in case of thinning, or a cover effect where scars post-transplant or post-trauma or injury are present. Another huge difference, the most important one, is the way the needle comes out of the handpiece. The scalp is divided into 4 zones: the hairline, the mid-scalp, the part of the vertex and the parietal area. Before starting the treatment, a project is necessary to outline the frontal line where we will be working. Project. The project is studied and elaborated with the use of a BB compass. The front parietal line will assume an M shape on the customer. Once traced the central point, going up straight, we will find point 1. By making the customer frown, point 1 will be right above the last wrinkle of expression. We will then take the compass and from the medial angle of the eye, we will climb towards the receding hairline, finding point 2A. Then we will proceed mirroring from point 1 to point 2B. We will trace then point 3 in the same way. We will check with the Phi pencil if all our points coincide before starting to pigment. Treatment. The head must be divided into 6 working areas. Starting from point 4, we proceed towards point 2 without cleaning the treated area, and then start again after cleaning from point 3 to point 1, point 4 and point 5 will be pigmented last. Key is that once reached the hairline, it is necessary to totally discharge a needle from the pigment and make more thinned and alternating dots on the line in order to not create an unnatural effect. It is also necessary that the trigopigmentation integrates perfectly with the native hair, especially in the parietal area, where the hair is often much thinner. This technique must also be used for thickening in the density effect. The treatment is divided into 3 sessions. During the first session, we go to recreate a dense network of dots equidistant from each other using the circular or small flower technique. The second session is used to thicken areas worked during session 1 of the treatment. The pigment initially used should have stabilized by now, allowing us to work very close to the dots initially made, avoiding the risk of creating hyperpigmented areas. The third session is for control and possible retouching. With this technique, it is possible to decrease the timing of the treatment that will last on average 2.5 hours. Every 12 months or so, maintenance should take place, which will consist in pigmenting again the areas already treated in a less dense way, with additional new dots to create a 3-dimensional effect on the skin.